still do.
Yes, and that one too is someone's business, and it will be very difficult for the person to stop. Just let the person know that the person has to take measures. You educate the person, let the person take measures to
Okay.
protect oneself. If the person can stop, and or there's a better option, why not? But if the person feels there's nothing he or she can do about the job she's doing, at least she should have some form of protection against the pollutants. Yeah.
Okay.
And and you would want to counsel her by demonstrating, like it's more of like motivational counseling, where
Okay.
you show her evidence of how what the person is doing is impacting her health negatively. Yes, and you then explore the alternatives, and then let the person knows that, okay, well, if the person, yes, but if the person cannot, then the person should still protect oneself against the pollutants. Yes. And for all you know, maybe the person didn't know the health effects of what she's doing. That's why she's still doing that. So why not?
Okay.
But you cannot think to make us Yeah. But it depends on how well you know the person and how the person will take it. Yeah.
Okay, sir.
Yeah. Okay.
Thank
Any
you
more
very much.
question? Welcome. Okay, so let's move on. Hey, where is my slide? Okay. So air pollutant impact on the environment, algae in lakes and all that, ground level oxygen vegetation, acidification, air pollutants impact on public health. So here are some list of so um, of conditions that are accounted for, that can be accounted for by air pollution, because I don't just want to just say yes can, because there are other things that can also trigger some of these conditions. So right from is it infancy to whether you are old age, everybody is at risk. Okay, so the child is exposed, and I think was it last year I asked someone, and why children are at higher risk, and the person said because the children are fond of playing on the floor and the ground. So when assuming the child is on the bare floor and the wind blows, all kinds of, yeah, there are many ways of explaining these things. Yes. And we have women too, and one other area too is your working place, where you work, what you are exposed to. So they at a point in time, you go around and you find out a lot of people are using asbestos as roofing sheets. Even from where I'm sitting, I can see a roofing sheet with asbestos, and it was linked with cancer, lung cancer. Yeah,
Okay.
asbestos. What in Ghana we call slate. When you are going to buy roofing sheets, they call slate. It is like kefi in nature, but it is like wood,
Like brown, be like
brown sort of. Yes,
mm.
yes. So even yes, on my left too, someone's toilet too. So it was common in Ghana. I think it was later on that the government realized it was a dangerous material to be exposed to, because they were getting asbestos and lung cancer. So a longitudinal study was carried out, and it was established that asbestos was linked with lung cancer and asbestosis. So our occupation is a major source of exposure. So some of the conditions include respiratory diseases and disorders. We have the cardiovascular disease. We have hospital admissions. So some of the conditions, you realize that there are certain times, particularly in abroad, where you have increased hospital admissions due to raised levels of air pollutions. Because there are some, taking the COVID, for instance, you realize that a lot of people, the number of people who will be going to hospitals to reports of hypertension, cardiovascular disease, and what of pulmonary diseases will reduce because you realize that the pollution levels have gone down. But in some areas, sometimes it will spike very high. So when you run correlation, you realize that it is positively related to pollution. So these are some. We have death, premature death, dementia, diabetes, adverse effects on lung and brain. It affects a lot of parts in the body, and particularly for women, when they are pregnant, it affects both the unborn child and the pregnant women. It has lasting effects on them. So air pollution impacts on we have in those solid. I think this one has been captured already. Air pollution, short term. So all these things. So is it air? Okay, so there are some reasons. So the health effects from air pollution depend on a number of factors. So you are saying that, well, for us to establish that someone was was negatively affected, the health of someone was affected by air pollution, then some conditions should be met. So we should be able to identify the specific pollutant. So is it ozone? Was the person exposed to carbon monoxide, or is it particulate matter, like fine particulate matter? So we should be able to identify that. And mostly that is done by taking the person's blood sample. So, and another, and yes, and it will go ahead to see. So how intense was the person exposed? So was it 10 micrograms per meter cube, or is it 100? So depending, so what in essence it suggests the exposure level. In some areas in Accra, you realize that the air pollution is what we call serious. Oh, okay. So the air pollution, it's something else. In other areas too, there are things that you say that, oh, air pollution should in New Hosa. So the intensity, so you have to establish the specific pollutants by taking the blood sample, and then the intensity of the exposure, and then the time course. So was the person exposed in minutes, days? So I mentioned that there are some air pollutants that like PM2.5 or the fine particulate matter that even when you're exposed to it within 2 hours, you see that your blood pressure is rising. For some of them, and for in a year, you are expected that the person will be getting hypertension. And for some of them too, in minutes, you should see a change. So the time, how long you've been exposed to the pollutant is also also accounts or also determines whether your health will be affected or not. And then the individual's health status. Some people already, they have weakened organs. So when they're exposed to these chemicals, it compounds like their kidney. They already have kidney problems, and they inhaled monoxide or some other, or they have asthma, and then they are exposed to these things, or they have some allergies. You see that these things, chemicals, will trigger those conditions. And some people too, well, they already have some genetic like asthma like this. Some people got it from their parents, and they are exposed to these things. So it will trigger the asthma. And you'll be wondering where and how this thing started. So you are saying that, so here you are saying that you have agreed that children are uniquely vulnerable. The reason being that they have higher risk. So this one, I should even leave it for you as assignments. Airways are narrower, shorter in height. So, and if I say an assignment, it's an assignment, and you know what can happen, right? So why are children uniquely vulnerable?
Is it an assignment?
You said? No, an assignment that I will mark. It's an assignment that I will not mark, but
okay,
if I were you, I'll learn.
It will come in the exams.
I'm laughing. You
understood?
Yeah.
Claire has not said anything about the exam so far.
Yeah. And mitigating air pollution to conduct health. So this is another part that also comes in the exams part. So if you want it in a plain language, so
pen and paper. Pen and paper.
That one for Cheho. Hey.
So if you can
So
Hey,
you
first
get to
Wake up.
Echo your last.
Rewind.
Yes.
so I
Rewind
just
Please
said
the
try.
fact.
Please try.
I'm
no,
not using
for me,
camera.
from experience, I said these two parts.
Hmm,
Etaba is on smoker.
okay.
So 5 minutes. Yeah. So how then what's the way forward? So we conduct health impact assessment to determine the magnitude of health effects associated in air pollution. So basically, it's trying to say you run a correlation assessment. So if you want to see if, for instance, you take hospital admissions attributed to cardiovascular diseases, then you take the data, you go to hospitals, you pick the admissions for them, and then if there are some, I think those responsible for the meteorological, they should have some monitors around that capture air pollution. You run the assessment to see if there's a correlation. Hey, I'm seeing some red lines on the screen, black lines. What's happening?
Oh,
Why is someone drawing on my screen?
no,
Whose child is drawing on my screen?
So someone is speaking.
no, nobody is
Oh,
allowed to even edit unless they are using the annotate site. That is why.
I'm not using any annotator. Okay, the person just made it vanish.
Yeah, somebody is messing with the
Hey,
undo.
already someone is hacking the system. Look,
Yeah.
Oh,
yeah.
go ahead.
So, okay, another way forward is to facilitate access to information on health effects of indoor and methods for reduce. So you realize that one thing we are not doing well about is how little would you even hear people talking about the effect of air pollution on our health, generally in Ghana. So it's one way to reduce the risk for air pollution or the risks associated with air pollution. And we also say we want to facilitate country actions to strengthen air quality by creating and implementing of properly coordinated policies. Yes, in fact, we have an act. I think it was produced in, I think, 2003. It has to do with, oh no, in fact, that one is e-waste management, an act of parliament, act, is it 962 or something? But there has to be one for air pollutions to aid EPA in their dealings. So we should have policies. We have to strengthen air quality management by implement properly coordinated policies from various stakeholders and controlling levels of air pollution. So it's not just a matter of creating the policies, but you have to make the efforts by controlling levels of air pollution sources. So the number of cars we use, and the factories, we have to be monitoring all those things. Implementation of building regulation that emphasizes the regulation. So we should have built or raised homes that have better or proper vent systems, transition from solid. So their implementation of technology and policies are proven. So please, these are easy to understand unless you don't understand anything. So so these things, they will come. They come. So
They're coming in the exams. Okay.
they come a lot of times. So so any
Please
questions?
note it down. They are coming. These things are coming.
Let's discuss the indoor and three outdoor specific requirements to minimize. Wow. Okay. I think yes. So this project was given to the regular students.
Hey, 12
So
June.
Okay.
you should take it up and do it. But you send it to my email, not Laurentia's email. Yeah. So when is 2 days ago,
Yeah.
So yes, so in a month's time, I'll
Okay.
take it.
All right.
In a month's time. And you see, some of you do not know how to answer questions. Yes, some of you do not know how to answer questions. Some of the time when you tell students in your exams, a lot of you could have made A's, but it's because of how you answered the questions. Some of the questions just states, then you find the person discuss, and you said that the person will just write the points, the person will just list them for you.
Pressure.
Yes. So taking the in and outdoor air pollution has far greater impact on. So you can start by discussing 3 indoor and 3 outdoor air pollution. So first you need the introduction. The introduction, you can talk about what air pollution is, and you can talk about the fact that it can be classified as indoor and outdoor, and you can show how it impacts countries all over. Like they talk about accounts for 7 million deaths, and then you narrow it down to low and middle income countries, how it affects, and including Ghana. Then you go ahead to mention that the recommendations that a country like Ghana has taken before you then take the points and then discuss one by one, and then you conclude. Okay, then that's discussion. But some of you, if you say the things I should just state or just list, that is just bullets, then you find students spending all their time. The ones that they should discuss, then they just write 1 or 2 lines for you. Meanwhile, the questions that says you should discuss carried more marks than the list and states. Some of them, the person write plenty, all for 2 marks. Meanwhile, the discuss is for like 15 marks. You see. So that is it. Any question? Any question? Any question?
Any question?
No question. Yes, sir, about examinations. I asked earlier on.
Yes.
How is it going to be like?
So likely you'll be writing the paper on campus. But, yes, but I'll have to confirm with Dr. Ansan.
Writing at campus.
It's not fair for us to learn online and write exams physical.
Why?
We didn't get the full rigors of the teaching, and we are going to face the full rigors of the examination. No. There is one there. There is one there.
Okay, so you let me discuss it with Dr. Ansan, and then the HOD will know what to do. Okay.
He said the HOD has actually told us that it will be online.
I'm yet to confirm that for him. So. Okay, then I think I'll have to leave you guys here.
Okay.
If anything, you can reach me. For now, now my phone is in the house, so you cannot. So afterwards, you can.
Without doing the annotation again.
Okay. Have a wonderful evening.
Oh,
thanks for your time.
Welcome.
Okay.
Thank you very much, sir.
A pleasure.
Bye.